Before we move ahead, I would just like to also welcome Dr. Susmita Chatterjee, who is the lead of this course. Susmita works at the George Institute for Global Health as a program lead for health economics, health system sciences. She has a PhD from University of Calcutta and is interested in investigating costs of health services, health financing, and economic evaluations. She has led several health economics projects in the areas of mental health, diabetes, cholera, typhoid, tuberculosis, and immunization, of which couple of studies were the largest costing studies conducted till date in India. She is a recipient of the Asia's Fellow Award in 2008, the Indo-US Public Health Fellowship in 2013, and the DVT Wellcome Trust Alliance Intermediate Fellowship in Clinical and Public Health in 2018. She was the core costing working group member for preparing the cost manual on provider payment mechanism, an initiative by the Joint Learning Network USA, the economic group member of TBMAC, and one of the authors of Handbook of Applied Economics and Vaccines. Before TGI, she worked as an associate professor at the Public Health Foundation of India. Sushmita, thank you so much for leading onto this course. And without further ado, I would like to hand it over to you.
Thanks, Akansha. And thank you for actually asking me for joining this course or leading this course, because I always feel that health economics evidence in policy is very much neglected in Indian context. That is one area which I always feel that people should learn and try to include that in their projects, so that at least the economic evidence can be supported along with other evidence. And eventually, I hope throughout this course, the course participants will understand the need of this. Because unless and until we feel the need, I think it is very difficult to incorporate in it and then do it properly. So that's that. Thank you for giving me this opportunity. Okay, and good morning, everyone. I have seen your bio, so I know some of you, not all of you. So that's why what I'm trying to do today and throughout this course will be to use a few examples which may be familiar to all of you. Like, it may not be only India specific, it can be applicable to any other countries, because I see participants from other countries. So let's start today's presentation. Why I am not okay. Before going to economic evaluation, talking about economic evaluation, let me first tell you what is health economics, because economic evaluation is actually a part of health economics. Health economics is a broad study. As you see that we have a program in George and many other institutes, which is a health economics program. That means it's not only economic evaluation, there are several other things. Now, let me first tell you what does health economics do actually, what we do. Now, coming back, I'm not now talking about only health economics, just think about the real world, okay? In the real world, in economics, we say that there are 4 inputs which are required to make the economy function, okay? In any economy. If you want to run the economy, you need 4 inputs. Which are those inputs? Land, labor, capital, and organization, okay? These are the 4 major inputs. Now, if you think of any of these input, let us take an example of land. Land is an area, right? If you think of this input, you will realize that there is a limited availability of land. At one point of that there is no land, okay? Like you can see, for example, now, when you are using the land for construction purposes, you are losing the land for agricultural purposes, per se. So that means there is a limited input, and for which you are choosing, because your input is limited, which in economics we say a constraint. this constraint will always be there. In terms of, I say in terms of land, and because this constraint will always be there, the scarcity will always be there, you have to choose. It cannot be unlimited, like land cannot be unlimited, labor cannot be unlimited, right? So that's the crux of economics, that there will be scarcity. And because of that, you have to have some thoughts from where, there's demand and supply and everything, all this economics theory came, but I'm not talking about those. What I'm trying to say here is your inputs are limited. Another very practical example, let us think about it. Suppose we have a fixed salary. I want to buy a BMW, that's my choice. But at the end of the day, I bought a much lower price car. Why? Because my resource is limited. Again, there is a choice, because I don't have that much of money to buy BMW, but I liked it, so I had to make a choice and bought something else, cheaper version. So that's the rule of economy. Now, coming to health, similar thing happens in health. It happens in any sector and happens in health. Now let us focus on health. What happened on health? In healthcare, I am sure all of you, not only from India, from other country participants, you will also hear that health budget is always very limited. Why? Again, because the resources are limited. We cannot give all money. Unfortunately, in Indian context, things are different. Like health budget is really, really poor. But what I'm trying to say is there is a scarcity. The budget is limited. Whatever budget we get, then we have to choose, because we have different options. For if you go by disease, or if you go overall, you will see that there are a lot of options available to the policymakers. And given the scarcity of the budget and different options, so again, in real life, we have to choose. In health also, we have to choose. Now, how to choose? And choose meaning, when you are thinking of a health of a country, then you have to choose efficiently. It's not only just choosing anything. You have to think what I should choose. So that's the crux of health economics. So you are comparing between alternatives which are available to you. Comparing this of what? So basically comparing in terms of two things. One is cost, which actually the price, and then valuation. I'll come to that. Price and cost are not the same thing. Cost is the valuation of resources. We have probably 2 sessions on cost, so I'm not going to that detail here. But what I'm trying to say is, when I'm choosing based on 2 different things. One is cost, that is value. Second is what the intervention is giving me. What is the benefit? What is the effect? The effect could be in terms of health, in terms of several other things that I will discuss today. But then, based on these 2, I have to take an efficient decision which one I should choose. And that's where the health economics help you. The health economics theory, economic evaluation, particularly in this case, helps you choosing one intervention over the other based on its cost and its value, its cost and its effect, which is the benefit. So that's the crux. So the health economics is a study which helps the policymakers think about making an efficient choice of various options available to them. That's the crux. So now, so basically then economic evaluation. Why I put this in red? Because this is again, as I said, the main thing. Resources are scarce. Choices must be made. You cannot do everything. Even if the alternative is giving you the best option, you have to choose one. You probably cannot do all 2, 3 together because your resources are scarce. Now, in economic evaluation, we'll see at the end of today, I believe that the participants will have a very clear idea about what the health economic evaluation does and how these are different, like how different economic evaluation are different. So in any intervention, in any whatever you think, it may not be intervention, it may be a program or whatever you think, it will have a cost and consequence. To start with, I will give you an example which I believe all of you know from wherever I see. I know that you are from various background. I have seen your CVs like bio, and you are from many background. But I think this example will be you will all know is COVID-19 vaccination. So I assume all of you have taken the vaccine also. So suppose there was a target population, this COVID-19 vaccination, right? Ideally, in normal situation, if it was not an epidemic, what we should have done is we should have done this kind of economic evaluation to think about whether we should do a COVID-19 vaccination or not. But it was a very different situation. We could not do that. And we started with the vaccination. But think about a situation like we are introducing this COVID-19 vaccine, which is program A. That's a new program coming in, which is COVID-19 vaccination. So that vaccination had some cost, right? Because that's a new vaccine. So when a new vaccine came, and you know how it was delivered, and it was the vaccine was for all, like it started with a targeted approach, but then eventually it was open to all adults. That means it was a very different delivery mechanism. Like it was not, there was no such vaccination program earlier which followed the route which COVID-19 vaccination followed, right? So that means it was a new program. There were a lot of manpower, a lot of vaccines, a lot of logistics requirement. It was there. So there was a cost. There was a consequence. Consequence meaning the benefit. What was it? The consequence was, can anyone put it in the chat? I want to know what was the consequence, like what was the output of the COVID-19 vaccine, why it was given, what it intend to do. Can anyone put this in the chat? I just want to know the answer because that will determine the other things. To prevent severity, complication, infection, prevent the spread. Okay. Go any other idea? Reduce mortality, hospitalization cost. Yes. So, okay, good. I got the answer. Those who said, okay. So, COVID-19 vaccination, the objective of COVID-19 vaccination was to reduce the severity of the disease. Okay. So the consequence, if you want to measure the consequence, it was hospitalization and death, mortality and hospitalization. COVID-19 vaccination was meant for those two things. It was not for spread. COVID-19 vaccination was never able to reduce or prevent the infection. It manage to reduce the hospitalization and mortality. So the consequence is that, so I will see that COVID-19 vaccination has a cost, and how much of my mortality rate or hospitalization rate reduced after giving the vaccination. Okay, now, as I say, I have choice. If there was no COVID-19 vaccine, what would we have done? We should have done something, right? What was that? Answer please in the chat. If there was no COVID-19 vaccine, what we should have done? Anyone? How were we managing the situation when there was no vaccine? What was my competitor? What was, yes, manage the disease, provide treatment. Okay, it's lockdown. Yeah, that's nice. Yeah, lockdown treatment. Yes. Okay. So got my answer. So my competitor is either do a lockdown or treat. I mean, lockdown was for spreading less spread of the disease. But think about the treatment part. If I think about, because COVID-19 vaccination was meant for reducing the severeness. So in that case, the comparator would be ideal comparator would be like treatment of the COVID-19 patient. So we were doing this, right? Initially, what we were doing when there was no vaccine, we were doing the treatment. And so in my case, comparator B is the treatment of COVID-19 cases, and program A is my COVID-19 vaccination. I have to choose this. I have to choose. So in ideal situation, as I said, I should have chosen before. I should have compared this before to see if I do this treatment, if I keep doing this treatment of the COVID-19 patient, what is my cost of treating those patients, and what is the rate of hospitalization, what is the rate of mortality, etc. That's the normal situation, which we call counterfactual or my competitor. And then came the new program, and that program has a separate cost. That program has a separate consequence, which is like reducing the hospitalization rate and mortality. Then we'll see which one is better, whether this program A is giving me lesser cost, better outcome. If that is the case, then I should choose the vaccine. If not, then I'll continue with the treatment. The ideal situation is this, and this is what the economic evaluation will help you to do, to think about that whether I should stick to just treat the COVID-19 patient as I am doing now, or I should focus on vaccination. Because think about the vaccination and doing the vaccination to the whole country population, it was very, very expensive activity. But if I compare this with the consequence in terms of reducing hospitalization and reducing mortality, we are not sure how it look like when you see this. We never tried to do this because it has already been implemented. There is no reason. I mean, there is no meaning of doing this kind of analysis at this stage after introducing. But this is what I'm trying to say is economic evaluation can help you if you do it before. Try to think that, oh, how it is working. Or a new intervention which is not there, you can try to see whether that works or not, whether it is very costly or whether it gives you very good return or something like that. So that's all about economic evaluation. Why my screen is not moving? Okay. So there are different economic evaluation methods, which I'll be talking today in briefly and eventually in greater details. So one, as you can see, cost analysis, cost minimization, burden of cost of illness, cost effectiveness, cost benefit. At the end of today's lecture, I expect that all 28 participants today, I see 28 participants today should be able to understand the difference between these methods. In everywhere, everywhere, when I speak with other people, those who are not health economists, they keep telling me that we'll do a cost benefit analysis. And or they say that, oh, I actually want to do a cost benefit, and we can do a cost benefit cost effectiveness analysis. Mostly I hear cost benefit analysis, and we'll do this. Yesterday I had my project dissemination meeting, and to my surprise, someone told me, oh, this is a cost utility analysis. It was not. I really want today's participant to pretty clear what are the differences between these methods. And when you say someone, please be careful that what you are saying, you really mean it. Because these words, these methods are used very, what should I say, very regularly in a very like common way, as if all are similar. They are not similar. They have very different meaning, and they have very different ways of doing it. So when you say, please try to, and if you have any confusion about any of this method, please put it in the chat so that I can answer today itself. But please be very clear about the different methods. So let us start with a cost analysis. Now, when I say economic evaluation and all these 5 methods, there are other methods also, but these are the most commonly used method. Now, we call some of them as full economic evaluation and some of them as partial economic evaluation. All are economic evaluation, but not all of them are full economic evaluation. I'll tell you why. Now, say for example, now first let us talk about a cost analysis. What is a cost analysis? Let's start again with the COVID-19 vaccination. You had COVID-19 vaccination. You have a comparator, that is the treatment of COVID-19 patient. Okay, that's fine. Now you are doing a cost analysis. What you will do? You will only look at the cost of delivering COVID-19 vaccine. That's it. That's the cost analysis. You are not looking, that's why I shaded those other consequences and other cost area, because you are not comparing anything. You are not looking at the consequences. You are only looking at cost of delivering COVID-19 vaccine, which means, as I told you, in the later lecture, I think second or third, I will talk about how to do this kind of analysis. Suppose you are thinking of COVID-19 delivery. What does it mean? It means that there were government staff, staff were hired often. They were given incentives. They had prepared a new area, like there were a separate COVID-19 vaccination area. Lot of vaccine, logistics, etc. were used. Using all those, you calculated only the cost. Now you may say, what is the use of doing it? Of course, it is very useful information, because this information this information, suppose you at the end of the day, what you will say is, you have a target population. After the end of this cost analysis, you will be able to tell how much did it cost to the government to give 1 dose of COVID-19 vaccine. This is an extremely important information, because suppose there is any other pandemic in later days, in future days, then the government knows how much money I need to be prepared for. Like, what should be my budget if something like this, I have to do it very quickly. In case of COVID, we were not prepared. We had to take money from other sectors, and as you all know, that during COVID-19 vaccination, a lot of other health services were disrupted because we could not manage. Again, that scarcity. Because we could not manage, we had to make choices, and that first choice was come and do the COVID-19 vaccination. So now, in future, for preparing for the future, the government will know how much did it cost me to provide vaccine to one person. That's a very, very important question or information for the government. I will tell you in later dates some few examples of my studies where I worked for the government only doing this cost analysis, just to tell the government that this is the cost per whatever the objective, and that was used for the budget of the program in future days. So this is one of the most important work one can think of. But what I have seen is people do not put much emphasis on this cost analysis. People are more interested, actually are not the researchers and also the funders. They like, the other terms, but they do not put much emphasis on this, which is actually required for the budget purpose. So this is one cost analysis where you are not comparing with anything. You have a program and you are costing it. That's it. There is another method, which is the cost of illness analysis. Now, this cost of illness analysis doesn't have to do anything with a new program. It can be done with any ongoing program or anything. But basically, this is disease specific. Say, for example, now you come to COVID-19, the disease. You want to do a cost of illness study. What basically you will do is, you will try to estimate what is the cost for treating the COVID-19 patient. It can be the patient cost, it can be the service cost, it can be any other cost, but you are not thinking of the vaccination, you are thinking of the disease. And you can say that, okay, if I spend this much of money, and this is my consequences, and if these consequences are not like reduction of mortality or something like that, you could say that, oh, if I have this disease, it could have this many people may die in your cohort because you have a target population for this. So there will be sample size calculation and other different story. But here in this case, for any disease, think of any disease where you work, you can do a cost of illness study where you will be estimating the cost and related consequences of that disease, and you are not comparing with anything. So because you are not comparing with the alternative, this is again a partial economic evaluation, but this is a method of economic evaluation. Cost minimization analysis. Here, suppose you have two alternatives. I am giving you here always two alternative examples, but in reality, there can be many alternatives available, okay? And you have to choose one. So here I'm just giving you two. Now, you have COVID-19 vaccination, you have the treatment. You cost the COVID-19 vaccination, that is your cost A. You cost the disease treatment of COVID-19, that's cost B, and you compare the cost, just the cost. You are not looking at the consequences. Your focus is to see which one is least costly. There could be study where the objective could be just to see which one is giving me, because suppose in some case, suppose I'm just giving you just for example, that suppose the COVID-19 vaccination and the treatment has a similar hospitalization rate and mortality rate. That is, vaccination did not reduce anything, just for example. If that is the case, that is the consequences are the same for both, then you are just comparing the cost. If that is that, you know that both program has the same consequence, same benefit, then you just compare the cost, and that is the cost minimization analysis. That is also a partial, because again, you are not comparing, you are comparing the cost, but you are not comparing the consequences. You are not doing the whole thing for the full, like two alternative, both cost consequences, you are not doing. So that this is again a partial one. Now I'm coming to the probably everyone's most favorite cost effectiveness analysis. Here, what we do again, COVID-19 vaccine treatment, COVID-19 vaccine cost, treatment cost, COVID-19 vaccine consequence, COVID and treatment consequence. Here, another layer is added, cost per unit of output. Now, based on your responses, tell me what would be the output. Ideally, what should be my output in this case? Like when I say cost per unit of output, what that output should be? In the chat, please. Any idea what would be my output? What are the consequence? What was the consequence for? Money spent is in the cost part. That is, I have done. I have done the cost of COVID-19 vaccination. I have done the cost of treatment. I am now looking at consequences. I'm looking at, you think about what I have got some, I have got some answers. If I want to get the consequences in terms of units, what I will look at? I need some number. What are those numbers I need in the consequences? Because see, cost is a number, right? At the end of the day, I will say that, oh, COVID-19 vaccination costed 1 crore rupees, Indian rupee. That's a cost. And treatment costed maybe 75 lakh rupee. Consequences. COVID-19 vaccination did this many what? Cost, again, I'm telling you, there are two different things. There are two different things. One is cost, that is already done. Its cost is all, when you are talking about cost, I would like to focus that cost will come in the cost section. I'm not talking about the consequences. I'm now talking about what were the benefit of doing this vaccination. Okay, so yes, now the correct responses are coming up. Number of hospitalization days. So what, now when you say people with complication, this is a little vague. What do you mean by complication? Complication could be different things. What is very clear, and the objective of the vaccination is, you all said that the objective of the vaccination program was to reduce the hospitalization rate, right? So that means that you will compare what? How many hospitalization was there in program A? That is number of hospitalized cases in program A, and comparator in case of treatment, how many were there? So you have a target population. I would not say that the cases prevented was the objective of the vaccination. So basically, you have to identify your output in such a way so that you know that this is exactly the objective of your program. If you are looking for some other outputs, that will not give you the right thing. Because as I told you earlier, you actually, all of you said that the objective of COVID-19 vaccination program was to reduce hospitalization rate. So your consequence is that if I give this vaccination, it will cost this much, and this will reduce this many number of hospitalized cases. That's it. And then in comparison group, so you have two different groups, right? You have a target population, but you have divided your group because you are comparing. So one group is receiving the vaccination, one group is receiving the treatment only. There is no vaccination. This group, which are given a vaccination, there are a lot of cost involved with it, not only delivery, but there could be other costs apart from the treatment cost. And then the comparator group is all getting the treatment, which has a cost. So you are comparing these two costs. Then the effect, the program group, the group who is getting the vaccination, there will be some rate of hospitalization, right? There will be some rate, like number of people hospitalized, and that rate you can use for that target population. And here also, for the treatment group, you will get few people who will be hospitalized. And then that's your consequences. So at the end of the day, you will see cost per hospitalization for program A, cost per hospitalization for the comparator. And that you will compare, right? Like if I have a cost per hospitalization 100 rupees per program A and 90 rupees for program B, that means program B, like comparator B, is doing better because that one, like the cost per output is lower. Or if you can go with the cost effectiveness research, I'm coming to that. But what I'm trying to say here is consequences is the number which you want to measure in terms of your outcome and or output. This output here in our example is the number of hospitalization, number of deaths which can be prevented. Suppose for the treatment group there were 10 deaths. For the program group, that is the COVID-19 vaccination group, there are 6 cases. That means 4 cases were prevented, 4 deaths were prevented. So that's the consequences which we need to compare. And at the end of the day, you have cost per unit of output for the program A, and then cost per unit of output for comparator, and then you do a cost effectiveness analysis. So I hope it is clear to all of you here that cost per unit output, this output here is your hospitalization, number of deaths, these. Again, there is a very common tendency to use DALI and QALY. I'm not saying that you should not use it, but be careful. What is your requirement? If you think of COVID-19 vaccination, your main objective is deaths averted. Your another objective is hospitalization averted. So why don't you use those as output? DALI, disability adjusted life year, can be an output. I can go into that. I will go into that, like why and when you can use that. But in our example, it is hospitalization and death. So what I'm trying to say here is output depends on your study objective. It does not always mean that you have to present it in terms of DALIs, disability adjusted life years, or quality adjusted life years. You not always need to do that. Based on your objective of the study, what you are looking at, you decide your output. and think about those, but not about just sorry, I'm pausing just because um, I'm checking the chat responses. Yeah, so I mean, if the vaccination is reducing the hospitalization, meaning that you are getting lesser number of cases, hospitalized cases, right? So your output is finally the number of cases hospitalized in your program and comparator. You have two different numbers and compare those. So that's what you should do at the end of the day. So this is cost effectiveness analysis. I hope you understood this. If there is any other question, yes, of course, death is another, as I say, mortality and hospitalization. These two are the major consequences of COVID-19 vaccine. I hope the output is clear to all of you, because now I'm going to this another favorite option, which is cost benefit analysis. Okay, so one thing I forgot to tell you that now see, in cost effectiveness analysis, we have done the whole thing, right? We compared cost, we compared consequences, and then we come up with cost per unit of output, cost per unit of output. We did the whole thing. So this is a full economic evaluation. Because till now, till before this, whatever I spoke about was partial, because we are not doing the whole thing. There were some like shaded areas. Here there is no shades. We have opened up, we have taken the complete thing, and this is the full economic evaluation. Let me very quickly check if there is any. Okay, I think there is still a confusion going on in terms of cost and effectiveness. Let me tell you again. Cost. So think about any program, anything, not only COVID-19 vaccine. Think of anything you can think of based on your experience. Any program will have a cost associated with the program to run the program. Even if you feel like, oh, the program is ongoing, what is the cost? Yes, there is a cost of running that program. If you think, what is the cost of COVID-19 treatment? There is a treatment cost. There is, because the government is spending money in terms of giving the doctors the salary, the space, the everything. So there is a cost associated with even COVID-19 treatment. Cost is one component. The separate component is the consequence. Like these two things are different. One is, when I do the vaccination, the government is spending money. That's the cost. And then there is, okay, don't think that whatever is spending is the cost. I just said it, but what I mean is, again, what I'm saying is that there is a cost associated with any program, but the consequences is what the program is giving me. What is this intended to do? That's the consequence. In this case, the consequence was that I expected that if I give COVID-19 vaccine, the mortality rate will reduce because of COVID-19. Because of COVID-19, the hospitalization rate will reduce. What does this mean? That means if I continue with the treatment, I will get certain number of deaths and hospitalization. But my expectation is that if I do the COVID-19 vaccine, I will get lesser number of deaths, lesser number of hospitalization. But both of these has a cost associated with it. Okay. Now at the end of the day, we are comparing what is the cost for doing COVID-19 treatment, what is the cost of doing COVID-19 vaccination, what is the number of deaths and hospitalization when I do the treatment, and when I do the vaccination, what is the number of deaths and hospitalization. Then I'm comparing this cost per unit of output. This output is the number of deaths, number of hospitalization. I hope it is now clear. Please feel free to put in chat if you still have confusion. Now coming to cost benefit analysis. Let me quickly check. Oh, okay. Got okay. If there is any confusion, please feel free to write in chat. Coming to cost benefit analysis. See the difference between cost benefit and cost effectiveness. Please keep these in mind. In case of cost benefit analysis, cost is fine. I have COVID-19 program, I have the cost. I have COVID-19 treatment, I have the cost. But in cost effectiveness analysis, I had the consequence in terms of number of hospitalization, number of deaths. Here, in cost benefit, if you want to do a cost benefit analysis, you have to monetize, you have to convert this number of deaths, number of hospitalization into money value. How to do this, I will tell you later because that's a method question. But so you have to monetize your consequences. As you probably are understanding that converting number of deaths into money value is not an easy job, right? So when you think about cost benefit analysis, think twice, because cost benefit analysis meaning your consequences need to be in monetary form. At the end of the day, you will say that net social benefit, which means cost is always in monetary forms, right? Indian rupee, Bangladesh Indonesia, I think Indonesia is rupiah, whatever your is valuation, you are getting the cost in terms of this unit, whatever your country unit, cost is always in monetary form. But getting consequences also in money form and saying that, oh, this cost minus consequence for when I say net social benefit, it's basically the difference between the cost and consequences in both cases. Because here, how we can do the difference? It's only because my consequences is also in monetary form. Say, for example, I'm saying that in case of COVID-19 vaccination, my cost is 100. My benefit, monetary value of my benefit is 200. So net social value is 100. For program B, which is my competitor treatment of COVID-19 vaccine, suppose cost is 100, but my monetary value of consequences is 150. So that is 150 minus 100, that is 50. But remember, my program A was 100. So there, which one is better? Program A, because 100 is more than 50. So that's the advantage of cost benefit analysis, that you are getting both in monetary terms. But getting this in monetary terms require some of you must have heard about some of these terms, willingness to pay. Or like, often we do like what is called is discrete choice experiments. There are different methods of how you value your consequences, because you have to transfer your consequences into money value. So that's the basic difference. I hope you understood what is the basic difference. In case of cost benefit, we can in case of cost effectiveness, we can just say cost per deaths averted, cost per hospitalization, something like that. We can present the result in that way. But in case of cost benefit, we have to say that for this cost, I got this much of benefit in terms of money. Like for 100 rupees cost, I got 200 rupees of benefit. For the competitor, for 100 rupees of cost, I got 50 rupees of benefit. So as I got 50 more rupees of benefit in case of my program A, this is preferred. That's how cost benefit analysis is explained. I hope you got a sense of Usha, I will come to your question. That is a different question which I am talking about later today's session. I'll come to this. But generally, I'm talking now mostly because I'm talking about giving you the example of COVID-19 vaccine. I'm mostly talking about the government money, but it's not always true. I'm coming to that in later stage. But I hope, just let me know if you understood the difference between cost effectiveness and cost benefit analysis. If there is any question, feel free to put in the chat. Because this is the distinction you should be very clear about. And you should not say that, oh, I will do a cost benefit analysis. But or whenever someone says in your team who is not familiar with the health economics terms, you should tell them, no, you cannot, you think about it, whether you can really do a cost benefit analysis, because in cost benefit analysis, you have to put this in monetary value. Can you do that? So just think about it, huh? So that's what. Now, I mean, I'm coming to the potential consequences or benefits, whatever we are saying. Now, your benefits, again, for cost effectiveness, as I said, cost effectiveness, generally people like to say that it should be DALI. It should be disability adjusted life years. But as I said, it is not always true. It is based on your purpose. It can be reduction in mortality, morbidity, as I said. If it is reduction in morbidity and mortality, then definitely you can do DALI. But if it is only mortality, if it is only hospitalization, then you just think about it. You can also say that this means what Usha was asking just now. One of the programs, suppose any one of my program is actually reducing the patient's cost a lot. Okay, my program is in such a way, designed in such a way which I really want my patient cost, what the patient is spending, it reduce. That's my objective. Then your outcome is that. So don't think that your outcome has to have like DALI, QALY, etc., etc. It's based on your objective, and you can go with several objectives based on your thing. You can, like, if you want to go to broader perspective, you can do like behavior change. You can think of what happened, like in case of vaccination, what we do is this is generally accepted thing to do in case of different vaccinations, because when we say vaccination, if some people in the community takes the vaccine, it has a hard immunity effect. Huh? So in case of, well, if you think of COVID-19 vaccination again, you know that like 100% of our people did not take the vaccine, right? But still, the severity, mortality, etc. reduced a lot. That's because there was a herd immunity. Because the herd immunity runs in the community. In any vaccination program, this herd immunity really works. We did not check what is it for COVID-19 vaccination, but generally it happens. So if you want to take into account those into your consequences, that is also fine. But if you want to stick to only reduction in mortality, reduction in hospitalization is also okay. It does not mean that you are not doing it right. It does not mean. That's why I'm always saying that don't think that making a very complicated study will be the best thing. It absolutely depends on what you want to do. You can go as broader as you can. CBA, if we do CBA analysis, then it is not hospitalization, monetary value of that hospitalization. So basically, you cannot say that this number of patients hospitalized is the case. That's not the case in terms of, in case of cost benefit analysis. Cost benefit analysis, number of hospitalization reduction, what is the money value of that? That's where the difference between cost effectiveness and cost benefit. Cost benefit, you have to find out a money value of that. Okay. I will answer your question in a different presentation, Utpal, because that's a different issue you are asking. I will talk about it, but not now. Now, there are other ways of doing it, which economic evaluation, which are budget impact and return on investment. These are little different ways of doing it. Budget impact analysis mainly focus on the budget impact of the government. Suppose I did COVID-19 vaccination. What was its impact on the government budget? How much total government budget or health budget or immunization budget, wherever it was fitting, it will fit in. What was the proportion of my budget was spent for this purpose? Okay, so that's what budget impact analysis. Generally, this is done for policy purpose mostly. Return on investment is another way. It's very much like cost benefit. In return on investment also, the result, when I say, I do everything similar, but when I come to the result, I say that if I invest 1 rupee today, I will get 5 rupees of return. This is what it says. Everything in terms of money, and then very clear, and its final result will be, if I spend today 1 rupee, I will get 5 rupee of benefit. This is how the return on investment things talk about. But another thing is return on investment generally takes a longer span, like 5 to 10 years. So that's where we, for the 5 to 10 years, we say that, oh, if I keep on investing this much money, I'll get this much of return. But at the end of the day, I say that, okay, for the first year, 1 rupee investment gives me 5 rupee return. In the second year, 1 rupee investment gives me 10 rupee return, something like that. This is one of the method which is very easy for the government people to understand, because they see that, oh, if I invest this much, I will get this much return. Oh, great. For the another alternative, if I put 1 rupee, I'll get 50 return. Oh, I'll go with the 50 return thing. That's the most easy thing the government can think of. So that's return on investment. But these two are not very commonly used, because that's not what we do very regularly. Okay. Coming to the final thing of cost effectiveness analysis, how you are going to put the ratio. This is cost of your program minus cost of your comparator, output of your program minus output of your comparator. This is how your incremental cost effectiveness ratio, that is how much additional you are paying for doing this program, will be presented.